As Ed pointed out, these are projections, and Republicans were immediately pouncing on it and saying, well, you know, projections are one thing, actual history is another, and the history of the CBO making projections under either party leadership has been at least scant. For example, the 2010 original CBO estimate for Obamacare subsidies versus the actual, as you can see, significantly more at $4,240 per taxpayer, significantly larger. There are other examples. I'm going to bring them up with Beating Obamacare author Betsy McCoy. Betsy, what do you make of this? Because obviously, one of the risks of Republicans repealing Obamacare is just that sort of stuff and that kind of press that it generates.
I think most Americans know that this report, which I have right here, is just fake news, Neil. It's fake news because it's based on the laughable premise that Congress will...
Was that the actual report that you ripped up?
It's only 4 pages, and
okay.
It's not worth reading twice.
All right.
It's based on the laughable premise that Congress will repeal the Obamacare law without replacing it. It's kind of like asking a doctor to predict how long will your patient live after you remove his heart and you don't give him a transplant, another organ. So obviously it's not the kind of projection that is reasonable to ask for.
Well, Chuck Schumer, I think the incentive for doing this was the Republicans haven't come up with a plan. They're so hot to trot to repeal it that they don't have a backup. What is the plan if they don't have a replacement right away to protect the ones, let's say, who already have the coverage now?
That's right. Donald Trump, president-elect, and members of Congress have reached an agreement that the repeal and replacement will coincide. In other words, there will not be a period of time when Americans don't have a new law with new health insurance coverage protections. People with pre-existing conditions will be covered. The low-income families who depend on Medicaid will be covered. And the large number of totally uninsured, Neil, people who lost their plans or who are now paying hardship exemptions, 12 million of them, penalties, 6.2 million families, that's about 10 million people. They can't afford these new Obamacare plans. And then there's another 5 million people who are technically covered, but Neil, they can't actually go to the doctor because they can't cobble together enough cash to get over that $6,000 deductible. So the other thing that the Republicans are going to do in their replacement is make sure there's a wide variety of more affordable plans, fewer mandates, another method of funding those with pre-existing conditions rather than on the backs of the healthy. They'll be taxpayer funded instead, and that will really control premium growth. Premiums have doubled since Obamacare went into effect, doubled since the end of 2013.
So play this out then. Republicans do have to be aware of having a fairly close replacement after they repeal, right? Maybe not immediate as Rand Paul wanted, but it can't be years, can it?
No, of course not. And the real key is that the date of the effectiveness of the repeal will coincide with the date when the new law goes into effect. They don't have to be legislated the same day. They just have to have the same effective date.
All right. Betsy, thank you very much.